This is management of type 1 diabetes. Group teaching assignment, University of Kentucky. Presenters Colleen Dussex and Jackson Hensley. Cognitive method. This presentation will be designed using the cognitive domain as its backbone. We chose the cognitive method because the domain is well suited to a presentation. We will reinforce the education given to the patient at the discharge and give a short quiz at the end of the session. This quiz will allow us to evaluate if the teaching was effective and where further teaching still needs to occur. Also, it will provide website information and apps as this age group is very tech savvy. Outcome statement. At the end of the presentation, the participant will correctly answer 3 out of 5 questions correctly on the post-session quiz. Behavioral objectives. After 20 minutes teaching, the participant will be able to accurately check their blood sugar and know the appropriate levels. After a 20-minute teaching session, the participant will be able to identify 3 signs of hypoglycemia. After a 20-minute teaching session, the participant will be able to identify 3 signs of hyperglycemia. Developmental age of the target audience. This project will be focused on teaching young adults on the social developmental stage. The crisis for this age range is intimacy versus isolation. To address the crisis for this group, we plan to make the material family-friendly while making sure that the lone person is able to participate. Our audience are patients that are newly diagnosed type 1 diabetes, age groups from 19 to 23, in an acute care setting at discharge. This presentation is not meant to be initial patient education, rather a reinforcement of those teachings after diagnosis and provide survival troubleshooting. This presentation assumes the patients can speak and understand English and have the ability to read written materials. This presentation is designed for small groups, 2 to 10 people. Teaching would take place at discharge in an acute care setting. Friends and family would be welcome to attend, and the time period for questions would be set aside at the end of the program. Benefits of learning. According to the American Diabetes Association, 29.1 million people in the United States have diabetes, and it is the 7th leading cause of death. New diabetics are admitted to the hospital in acute illness associated with diabetes. This teaching can decrease the chance of readmission and provide the patient with the opportunity to manage their own health care. Young diabetics are at risk group for not complying with the health regimens. This teaching can help bring the seriousness of the disease to light. Insulin is a hormone created by the pancreas that aids in the ability of the glucose to go into the cell. With diabetes, insulin does not effectively control blood glucose. Hypoglycemia, which is low blood sugar, can be fatal. Hyperglycemia, which is high blood sugar, can cause blindness, kidney failure, cardiac problems, and death. Monitoring and taking action when your blood sugar is too high or too low is the secret to leading a full life. You need to check your sugar levels often. You want to maintain your blood sugar between 80 and 120 milligrams per deciliter. Check before you eat a meal, and then check again 2 hours after you eat a meal. You need to keep a journal of your blood sugars to give it to your doctor on your next appointment. Complete your high and low controls on your glucometer every day. It is important to get accurate readings. Your controls and your strips expire 90 days after you open them. You need to follow your control instructions step by step to get your accurate reading of your fingerstick blood sugar. Hypoglycemia, when you have low blood sugar, is caused by not eating enough, too much insulin or diabetic medication, more activity than usual, drinking alcohol, or illness. Symptoms include shaking, anxiety, hunger, headache, vision problem, sweating, dizziness, weakness, and fatigue. And some people say cold and sweaty is a big thing with the hypoglycemia. It's imperative that you treat hypoglycemia immediately. You want to check your blood sugar right away. If your blood sugar is less than 70 milligrams per deciliter, or you cannot check your blood sugar because you don't have a glucometer or you're not in a position to do it, you need to supplement it right away. Half a cup of fruit juice, 3 or 4 glucose tablets, a tube of glucose gel, a cup of milk, or a tablespoon of honey or sugar. You just need to find something and eat it. Do not delay. Then you have to recheck in 15 minutes and repeat if necessary. If you continue to have low blood sugars, you need to call your doctor. It's an emergency. Hyperglycemia is caused by not enough insulin or diabetic medication, too much food, not enough exercise, medication, stress, or illness. Medications such as steroids can cause your finger stick blood sugar to go up. Some of the symptoms of high blood sugar include extreme thirst, dry skin, blurry vision, nausea, frequent urination, hunger, or drowsiness. When you feel like you might have a high blood sugar, you need to check it again right away. You don't want to delay treatment with your high and low blood sugars. Check your blood sugar, take your diabetic medication as prescribed, drink plenty of sugar-free, caffeine-free drinks. Now this doesn't include Pepsi. It's got to be sugar-free and caffeine-free, because otherwise it won't help. Follow your meal and activity plans. Check for possible infection. Are you sick? Do you have a bad tooth or a sore on your foot? Call your doctor if you've got unexplained blood sugars 3 times a week. If you're sick and have 2 blood sugars over 250, or if you're having problems leveling your blood sugar range. Now here's your quiz. How often do you check your controls on your glucometer? What are 3 signs of low blood sugar? If you feel like your sugar's low and you don't have a glucometer, what are you going to do? What are 3 signs of high blood sugar? Name 2 treatments for high blood sugar. In reviewing, we cannot emphasize enough how important it is to check your sugar often. Keep a log of your results to give to your doctor on your next follow-up. Do not skip meals. Don't delay treating your sugar at all. If you have low blood sugar, treat it right away. If you have high blood pressure, treat it right away. Some people I know that are diabetics have food set aside just in case this happens. Now, it doesn't mean you carry a candy bar around with you and eat it every time you feel like your sugar's low. The best thing to eat with a low blood sugar is something with some complex carbohydrates, but you should have something on hand so you don't have to go struggling to find something. Now, there's some helpful websites that you can watch. One of them is American Diabetes Association, and there's also apps that you can get for your phone. 2 of the more popular apps are called Gluco and it'll help you track your glucose and keep track of what your blood sugars are and what you're eating. There's another one that's IBG Star, which also helps track your blood sugar and your blood pressure and your levels of your sugar on your food. And are there any other questions? Does anybody want to go over anything? But the most important thing, check your sugar often, keep your glucometer in good condition, follow up with your doctor, and don't skip meals. If there's no other questions, I want to thank you for your time, and I hope you feel well. And know that if you do have questions later on, you can call your doctor, you can call us here, or you can check the website. Anything that you need that you feel like it could help you with your care would be fantastic. Good luck. Thank you.